Oh gosh.
Ba 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 da do ba do do do. Ba 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 do. Ba ba ba. No blowing your nose.
I know. I can't do that anymore.
And thank you so much for being here with us. This is Naomi Schaefer. I'm the Executive Director of Clowns Without Borders, here with 4 incredible medical clowns. And we are going to get started. And I first will love our wonderful speakers to introduce themselves. So we'll go alphabetically and start with you, Adam.
Oh, I'm so glad it's alphabetical. Happy to be here. I hospital clown for over 25 years. I started with the Big Apple Circus Clown Care Unit, worked with them for 7 years, worked with the Making Headway Foundation for 20 years at NYU Hassenfeld, and then Roosevelt, the Institute for the Inn, which was also underwritten by the Needler Foundation. And when I got really good at it, that's when it ended. Mount Sinai sadly turned down my fully funded position. Oh, I'm sorry, I mentioned Mount Sinai. But I miss doing the work so much. You know, it made me a better person. And I thought I was doing it as a job. And as my mentor, Michael Christensen, would say, the joke is they think we're doing it for them, but they're doing it for us. I got so much more than what I gave. And again, by the end, I thought I was pretty good. Oh, I have a Java command. I guess that's my cue. I'll send it over to Calvin.
Adam Oslander, everybody. My God, that's quite the resume. And I'm so honored to be part of this panel of healthcare clowns today. I am coming up on my 10th year now. This is 10 years as of September of this year will be 10 years with the Medical Clown Project here in San Francisco. Not this background. This is probably somewhere in Hawaii. You don't get these types of waves and palm trees in San Francisco. But I've been healthcare clowning for almost 10 years now, and it's been incredible. Just like what Adam said, this is something that's truly a fulfilling experience. It's great to do stuff for others, but you get that experience right back. It's an incredible experience. But really, it's wonderful that we get to take circus and clowning and really provide joy and laughter in not just in this time, but in times where people are struggling emotionally and in stressful environments. So that's my first take on healthcare clowning, and we'll take it away to Leah.
Hey guys, Leah here. Sorry, I just woke up from a nap. Oh yeah, I'm supposed to tell you about my experience. So I work at Boston Children's Hospital with the Foundation of Laughter, and formerly one of the Big Apple Circus Clown Care Clowns. And I also run a nonprofit called Circus Up, bringing circus to youth in the Boston area, underserved youth. And work with Clowns Without Borders for many years. This is Anjou. There's 2 more dogs. She's leaving now. And I can't wait to just share my experience hospital clowning and what it's meant for me and for some of my teammates. And it's really been a joy and difficult. And it's always super great to be part of the big hospital team. That's something that feels super important to me. Oh, Meredith.
Hello, hi. I'm Meredith Gordon here in Atlanta, Georgia. I have been a hospital clown for the past 20 years. I'm actually celebrating my 20th anniversary this year. I started as the Big Apple Circus, or as part of the Atlanta Big Apple Circus Clown Care team. In that structure, about 3.5 years ago, we started Humorology Atlanta to continue the work, which we are continuing to do here in Atlanta. And you can see the Humorology Atlanta website at humorologyatlanta.org, and there's also a Facebook page. I also am a social circus coach with SoCirc. I'm the director of clowning there. And just late last year, I had the pleasure of going on my very first trip with Clowns Without Borders to a hurricane relief trip, which was very, very cool. So that's the Reader's Digest version of my clown experience.
Thank you all so much. So I wanted to start with just a question of what's a golden moment for you? When you think back over your many years of hospital clowning, is there a moment that sticks out? Something that's like, oh yes, this person, this moment has stayed with me, and this is why I believe that hospital clowning matters. Adam, we're gonna stick with you and stick with the alphabet.
Yay. So I have two things that come to mind. And I think many a hospital clown would tell you the story of the time that they blew bubbles for a kid who couldn't use their left hand and would reach out with their left hand because they saw the bubble. And my other, and I'm getting goosebumps, and if I start crying, forgive me. There was a pilot study at Columbia Presbyterian Hospital when it was called Columbia Presbyterian to basically see about getting funding to actually do, it was a pilot study for funding to study the effects of the clowns on the release dates. I'm not using the right words because I'm so excited to tell the story. And one of the things that we did is we participated literally in the kids who were getting tested. They would come back once a year for their what is the word?
A checkup?
No, donors. They were donor recipients. And one kid was having, what's the, just brain fart right and left. The spinal tap thing that they would do where they would stick a needle into the base of the spine. What's the word for that? I still am traumatized by it.
Spinal tap.
Lumbar puncture. Oh my God. So
Ooh.
just witnessing a lumbar puncture, I would say, is one of the most horrendous things, because literally they're putting a very huge needle into the base of somebody's spine. And so I was there and feeling uncomfortable, still doing my stuff and obviously not ignoring that. And, you know, as hospital clowns, it's our job to leave when we're not needed, you know, and not be there to it's like, we're not Robin Williams. We're kind of like, we listen to the room. And I felt like, so we said, you know, maybe we should go. And this kid, I'm going to cry. He was like, no, stay. And the nurses told us, it wasn't only in this situation, but others where they would put a camera literally up the leg and inside to look at the hearts. I mean, it was crazy. Said that the kids were the calmest they had ever been in their experience. So if I live with that forever, it's something I'm extremely grateful for.
Thank you. And
That's
Calvin,
beautiful.
do you have a golden moment?
Oh gosh, there's so many of them. Which one to choose from? I'll give a couple as well. And I think one of them was there, as we all know, that children can be very shy and scared when they go into a hospital, and anyone who comes into the room, they're scared of because they're strangers, and they don't really know who they are, and it's a very different environment. They're not wearing street clothes, they're wearing sometimes gowns, and so that look could be a bit scary and cause some anxiety. So this child was with a couple of parents, and we were trying to find a way to connect, but this patient really didn't want to interact. She was very shy. And we decided to play with the parents instead. So we played with the parents, and we just basically just briefly talked with them, and they were enthusiastic with us being there. And we have this thing called it's an energy tube kind of thing. And basically it's this clear tube. You hold on to one end, and then if you hold on to the other end, it lights up. Well, what we did was we created this system where if I'm holding a clown's hand, and I'm holding a tube, and then they hold onto the tube on the other end, it creates the full connection. So it creates this wonderful circle. And we did this with the parent, right? And the parent enjoyed it, and they were really amazed by it. And we just took the stick and we just gave it to the parent and say, oh, if you want to play with this stick with anyone right now, you can go ahead and pick anyone you like to play with. And they chose to obviously play with their daughter. And they started making the circle, and they connected the tubes, and then they touched hands, and all of a sudden starts lighting up. And then she starts breathing, and she sees this wonder of this tube. And then she says she wants to do it one more time, because earlier we were joking around, and instead of holding hands, we were touching each other's noses and goofing off. And they all connected holding the tubes, but in order to make the final connection, instead of holding hands, the daughter went to the mom and gave her a kiss. And then the tube lit up, and it was just this beautiful moment, just not even being a part of it, just allowing them to have an opportunity to play with this toy that we had. And that was it just reminded me of how powerful this work can become.
Thank you so much. Yeah, it's really exciting when the audience takes the show and makes it their own. Leah, I'd love to hear your golden moment.
Yeah, I think like everyone, there's many to choose from, and we have a bunch every day, every time we're in the hospital. And so it is hard to choose, but I think for me, I think a lot about, before I kind of tell an anecdote story, I think I'll just say that like people have mentioned already, that there are so many moments that are just like, feel like a win. And sometimes we don't even know if those moments are a win. So if what we get to do is put the child in charge. And so sometimes that means that the kid is inviting us in, or the parents or guardians are inviting us in, and we get to play. And sometimes it's a really slow start, like Calvin mentioned, and sometimes it's super short and quick and fast, and it's just a few passes by the door that are ridiculous, and that's it. And sometimes we're there for a bit longer. Perhaps we're helping kind of with a procedure, not do the procedure, is not for me, but guide, help calm the kid, and even the parents or guardians help through a procedure is really what I should say. And sometimes that also means that the kid gets to choose. So they don't get a choice of who comes in their room often, 99% of the time, because they need the help. That's why they're there. And if they say, hey, not today, that's totally fine. And we just say, all right, see you next time. And so that also is a win in being able to give that kid that agency. So yeah, we all think have those kind of reaching for the bubbles, that kind of thing story. Or often there's a kid who, after surgery, they're getting up to go walk down a hallway, and they need to be able to do that within a certain kind of time. And we get to help make that first walk super fun and interesting and a distraction. And so they get through that walk a little bit easier. And so I think all of those small moments are wins for me. I don't know, win, I keep saying that word, I don't know why, but I'm just winning. But
thank you so much, Leah. And I'm gonna pass it on to Meredith. Do you have a golden moment?
Yeah, there are two that come to mind, especially in terms of dealing with patients and families and the staff that we deal with. I was working about 3 years ago, and I got a call from one of the volunteers who basically said, there's someone in the volunteer office that wants to see you. So I go to the volunteer office with my partner, and this woman is there, and she shows me this picture. And I look at the picture, and the picture is a picture of me from 15 years earlier, when I was clowning for her son, who at the time was maybe 3. As it turns out, her son had an illness. He was treated when he was 3. He turned out to be fine and healthy. And then 15 years later, he's graduating from high school, and he's doing a high school project to donate things back to the hospital. And his mom still has this picture of me and the clown that I was working with at the time. And she had no idea if we were still there or if we were still doing the work. But just knowing and hearing her talk about how impactful this relatively short visit. Of course, I had no memory of this visit from 15 years earlier, but she literally said that we were there for a few minutes. And I even asked her, I said, well, did we juggle? Did we sing a song? Did we bump into the wall? What did we do? And she said, you brought smiles. And it was just the simple act of, of alleviating some of the stress and the pain in this mother's life was really impactful, partly because she was coming back to tell us about it. A caveat to that was a few months later, I was in a hospital at Eggleston, and another woman walked up to me, and she said in a very, very calm voice, she said, I remember you. You played for my child. Long story short is her child didn't survive, but she remembered me and my partners singing and playing with her child before her child passed away. And her child had been a frequent visitor in many, many visits and many, many times. But hearing how grateful she was at having those moments where instead of being one of the things my mentor as well, Michael Christensen, would often say is treat the well part of the child. So we're not treating a cancer, we're not treating, a broken leg or an esophagus. We're treating the spirit of the child. And to be able to do that and to have the mom thank me in such a pure and kind of like respectful and calm and just grateful way was very, very moving. And knowing that this mom whose child passed away and was very, very grateful of the time that she had when she could just play with her child with the clowns, and the other parent who had a child who survived kind of bookmarked the experience both with the patients and with the parents that we have.
Thank you so much. So I want to piggyback on Meredith and Leah, something that you said about seeing the child and not the patient, and then also what it means to put a child in charge. So I'd love to hear more about that. And I also know that we've talked about children, but that also sometimes we, as hospital clowns, perform for adults. And so if you want to adjust my question to fit the audience you perform for, excellent. Anyone watching on Facebook Live, if you text in a question, I will ask the clowns. Over to you, Adam.
So we're not only there, obviously, for the kids, but we're there for the parents and the staff. And I think Calvin mentioned, we look for open doors and we ask for permission. So it's kind of like street performing in the sense that you can't get anybody to watch you. So you're there checking the boundaries at each step of the way. If a kid, and again, how do you explain that you're feeling what's in the room and responding to basically unspoken permissions sometimes? So oftentimes I would engage a staff member and entertain them or do something with them, which would allow the kid or a sibling or a parent. So I found that to be a lot of fun because I wasn't just there for the kid. Or the kids. And, we had patients from anywhere from newborns to 26. So you're definitely reading your audience. So if I had a set idea of what I was going to do, I was in trouble. But, I had a bag of tricks, but then, you kind of had to throw all of that out and go into a room with, okay, it's literally the ultimate in improvising and street performing, because it's like, I'm yes-anding, I would go from a room from a 16-year-old who I would maybe use off-color language with to, a 3-year-old who I would, bump into the walls with. So yeah, using the whole environment. And again, having to respect that environment and feeling, this is the great gift of being a codependent. Who doesn't want to be talked to? Who is angry that day? Who needs their lunch? And just to not take it personally. It took years to do that. I'll say briefly, the first year and a half that I did this job, I felt like I was responsible for everything. And I read a book called How It Feels Like to Fight for Your Life by Jill Kremens, which is a photojournalistic book. She was Kurt Vonnegut's wife, a photojournalistic book on basically kids with chronic illness. And reading that book allowed me to really understand, and of course I had the experience, but it allowed me to understand that these kids are kids, they don't want to be sick, and they're still kids. Like, I didn't have to go in, even though I was trained that I couldn't fix anything, I still felt this incredible need to do that. Like, if I wasn't funny, someone was going to, you know, have a fit or something. And it just allowed me to do my job and to trust that what I brought was enough.
Yeah.
Calvin.
Thanks, Adam. Yeah, I love that. I love that. Being you don't have to do everything when you're in there. It's being able to just kind of breathe in that space and see what happens. And what the philosophy that, at least for my personally, what I've been trying to do over the years is really discovering what the game is with each person. And with Naomi, you mentioned how you empower the patient, whether it's a child or older adult. We at Medical Clown Project, we do a lot of work with older adults in assisted living facilities and acute care. And there's one instance that we when we're trying to find that game, when we're trying to find ways for them to feel empowered, Leah mentioned this a little bit, which was a no is just as good as a yes. Being able to say no for someone who's coming in and into your room, for the clowns to say, yeah, you know what? We don't have to be here. Let's go. See you later. It was nice to see you. And then go on our merry way, and we can even find a game within that. But another thing of if you did get that yes, and we have this game of how do we find a way to empower this person, we can get to a place of physicality, whether it's maybe this person does this motion and we get affected by it, and we use slapstick to show this fun playful way for them to use their movements. All of a sudden now this physical therapy that they were supposed to do becomes this game that they really truly love. Being able to say, like in improv, being able to say where they want to go. Some people say, I don't want to be here right now. I want to go home. So we say, yeah, let's go home. Where's your home? It's in Wisconsin. Okay, let's go to Wisconsin. Would you like to take a train? Would you like to fly there? Or maybe we can take a cruise ship. So there's all these different ways. Now all of a sudden this person has choices, and they follow this path, and they make these decisions where we follow through with their decisions. All of a sudden they're telling us what to do. And that's a very empowering thing for not just a child, but for an older adult and everyone who is involved. So that's my take on giving a patient empowerment.
Oh, all right, sorry. This is Slurpee, everyone. He's just getting his, his daily dose of belly rubs. All right, so I'm going off of what Calvin said, who, as you can tell, is one.
Leah, we need you to speak louder.
I'll start yelling. I'm very close to the camera now, Naomi. I only take direction from
Kids.
Exactly. So actually, but that was what I was going to say. That was perfect. So going off of what Calvin said is that we give the folks that we're clowning for, we give them the opportunity to be in charge of us. So they get to kind of, I'm sure everyone has this experience, but they get to direct us around. So if they want us to walk into a wall because it makes them laugh 15 times in a row, like, okay, like that's what we do. And over and over again. But it's great. The great thing about that is you don't always, if you're just kind of like living it, you don't always have to think too hard about what's coming next or necessarily have a shtick, because they'll tell you what to do. And sometimes it's nice to have something to kind of like fall back on. The other thing is that we we get our cues from everyone at the hospital who works there. Sometimes the kids, okay, sir. Sometimes, there he goes. Okay. Sometimes we get cues from parents or guardians. Sometimes it's the nurses. Sometimes it's the environmental service folks who are working and they know the kids really well. It kind of comes from everybody, because sometimes we'll be in a room where sometimes I'll walk out and I'll go, well, that didn't go well. And then we'll get 8 minutes later, oh my God, that kid loved you, please come back. Or make sure you see them tomorrow or the next week or whatever it is. And I think that's often, sometimes the kid, because of the situation they're in, they can't necessarily laugh or guffaw, or the way that they show it wouldn't be what we're sort of typically used to. And so that's really beautiful to be able to have the input from everyone there, and also from our teammate, because we always work in pairs. And so we also get to bounce everything off of whoever we're working with. And that's really wonderful, along with everyone that we're working with. And you can read about all of the, oh, there they go, they're wild. Sorry. You can read about these more stories in Beyond the Nose.
Yes.
Yeah, Tiffany.
Tiffany Riley.
Bye, Tiffany Riley.
I will add that into the comments, and now we're going to pass it over to Meredith.
Hi. Yeah, great points everywhere. I was kind of listening and hearing bits and pieces of things. One thing that I think really kind of goes to the point that Naomi was mentioning about empowering the child is we work as partners. We always work with another person. And so one of the things that gives us the advantage of doing is at times we can work with each other and kind of clown and play, and sometimes just simply let them watch. They may not want to be directly involved or necessarily interact with us. Maybe they just want to simply watch a performance. One of the things, I try to break things down into kind of a simple way to understand it. And one of the philosophies I come up with is find the game, play the game, and finish the game. Finding the game is finding whatever the activity is. Playing it is giving it all. And finishing it is, at some point, you put a period on it or an exclamation point or a question mark, and then you finish it. So, so I try to follow that arc in all of my routines. And to go back to the very, very first point, we as clowns and as performers, we try to give them, as Calvin was saying, take them anywhere they want to go, be it literally, figuratively, or with their imagination. But before we can do that, we have to meet them where they are. Mm-hmm. We have to see where they are and kind of acknowledge that and respect that. And sometimes that might happen in a second. Sometimes that may take a relationship. It may take, weeks or days. Sometimes it may take 5 minutes or 10 seconds, but you kind of have to meet them where they are and kind of earn or get, however you can, that respect or that trust. And then you can kind of take them anywhere. You can, as Calvin was saying, you can take them to Wisconsin on a train trip, or you can do physical things, but you kind of have to meet them where they are. And sometimes, as Leah was saying, sometimes it's kind of like honoring the no. If they say no, it's like, okay, well, no. And I've seen several times I've honored the no and I've walked away and they kind of go, well, where are you going? It's like I said no, but like now I'm kind of interested. I was expecting either a struggle or something more, but now that you're leaving, it's kind of like maybe I kind of want to see it in some way. So a lot of it, even as Ed was saying, is a matter of kind of like meeting them where they are and kind of having to be vulnerable and touch them or kind of meet them where they are.
Thank you. You're now in gallery view, so and I have 2 questions from our audience. And Calvin, I know that you have to leave soon, so you get to choose which question, and we'll break our alphabetical order. So one question is, what's it like to do this work by Zoom visit? And have you been doing any Zoom hospital clowning? What's that like? And the other question, I'm glad I don't have to answer, is has your experience clowning in hospitals and witnessing other people's moments of hardship, how has that impacted your ability to manage or bring joy to your own hardships?
Oh gosh, I have to choose between
Wow.
those questions. I mean, well, just so you know, I think I'm actually okay if in time now. I have an extra 15 minutes beyond at 45. I'll probably have to run, but I'll start anyway if it's okay, Adam. All right. I'll briefly touch upon the last question, and I think because I do want to talk about the virtual a little bit more. But briefly, in terms of how it's affected my life, it's been tremendous in being able to, if you're able to see a patient where they're at, and you're able to listen to their needs, and you're able to just have that love and compassion opened up every single shift that you do, it's going to bleed into your life. You're going to be able to do this for your friends, your close people, strangers on the street. It just reminds you that it's really not about you. It's out there. There's so much that so many people who need us beyond hospitals, beyond the people who are in the hospitals. We all need it. So I'm going to briefly put that away, but that's definitely a discussion I would love to continue talking about. But in the virtual world, we started doing virtual visits about 3 or 4 weeks ago. And it's been incredible having that translated from in-person to a digital setting. And the interesting thing that we're learning is about how we are able to establish the connection. When you're in the hospital, it's about meeting them where they're at and making that human connection and finding rapport and finding that game. That all still works when it comes to a virtual setting. You're still able to find ways that connect. So tactically and technically, you want to look at the camera so that it looks like the person who is talking to you is looking directly at you, so you can create that connection. And then also the listening, really slowing things down and finding what it is if they're responding to what offers you're making to them. And also there's the delay of the lag, which is part of the equation, but really listening and really slowing down and really trying to focus on how can we connect more here. And that play, this becomes this window of this fun theater of going in and out. You know, you have the closeness, you have the far away. I mean, the closeness is great because normally you can't get this close in person, but you can on a video. So these are wonderful things that actually translate very well in a virtual setting. And I would love to hear more what the other clowns think too.
Oh, is that me?
We're whoever wants it, go.
Okay, well, great. Well, we here in Atlanta at Humorology Atlanta are just starting our nose to nose program. We're still kind of like working out the kinks, and we're looking forward to having a great time with it. I was involved in a pilot program, which we're still kind of doing a week or two ago. And to the points that Calvin was making, I found myself being more conscious about trying to do all of those things that I was saying and that Calvin was saying in this medium. And one of the things I learned in the time that I was doing it is that I had to be a little slower, as Calvin was saying, and a little more deliberate, because when you're in the room, you can pick up on things a little more easy, body language, the tone of the room. Sometimes there's one person in the room who kind of, if you win them over, everyone else kind of follows. But when you're dealing with just the camera, you have to be really more deliberate and make sure that they're following you and that they're watching. And I mean, there are technical things you can do with cameras and screens, which are kind of cool, but you still have to really make sure that they're following you and that they're watching. And I did a lot of at one point I was playing and I was consciously watching, and if the patient was like jumping, I would say that. I would say, oh, I see you jumping, I see you dancing, I see you doing this, I see you doing that, just to let them know that I see them so that they can respond back. If you're in the same room, those things are automatic, but in this medium, you kind of have to communicate it and you have to be more deliberate about it. That's my take.
Naomi, can you ask the first question again? It's just been a while. I forget it.
Oh,
Yeah,
I
it's
didn't,
been a while.
what was the
So
first question? I didn't
Well,
touch on that.
the first question, which I think we've answered, is around Zoom clowning. How do we clown on Zoom? And the second question, I think it was the second, I don't remember which order I asked them in, is how does sort of witnessing and relieving hardship in someone else's life, how has that prepared you or impacted you in sort of
yeah.
bringing a sense of clown to your own grief?
Oh, wow. I just
Or
briefly,
Leah, do you have a thought on that?
I'm sorry, were you talking to me?
This is the
Meredith, do you wanna
clown
answer?
panel.
Yes. I'll just say that one of the things, I kind of, again, tying into what Calvin was saying, it's made me much more patient and a little more responsive. What we do as clowns isn't therapy directly, but it's made me much more aware of the therapeutical dynamics that can happen and taking care of my own needs and as I'm trying to meet someone else's. So that's more or less that.
Yeah, I would say resiliency is one that holds true for me. This work really helps build resiliency.
Leah, do you want to answer, or I'm happy to jump in here?
You go, then I'll go.
So the brilliant Larry Pizzone said, I can't make anybody laugh. I can only evoke laughter that's already there. So I didn't go into rooms thinking I was dealing with hardship. And as my Catholic wife will say, everyone's got a cross to bear. And I'm hers and she's mine. So I didn't go into any situation with the presumption, like sometimes the kid with the brain tumor was the happiest one in the room and the parents were the one with the most depressed and anxious. And as kind of an aside, I knew a kid who's a brother. So the kid was, I think, 2 when he was diagnosed with his brain tumor. And when I want to say he was like 6 or 7, he was like, so when is my younger brother going to go through his treatments? Because that's what he knew. So that was his normal. Like, we think that maybe we should have felt sorry for him, and he didn't know anything different. And it's a really touching, like, that was his life that he accepted in a way that we can't ever understand. I'll also say personally, and I'll admit to being selfish, insecure, self-loathing, and I could go on. And what this work gave me, so with the Big Apple Circus, I partnered with people, but then after the Big Apple Circus, I was on my own. So in a sense, I partnered with the staff, the parents, and whoever I could partner with and bounce off of. But again, as you know, I got so much more than they got. I got practice every day to get out of my own self-centered head. And it took me 25 years to get good at it. And one more last thing. Early on in my career, there was another adorable kid with a brain tumor, and his mother's patient, like, I saw what parenting was, and I've told her that watching her allowed me to realize A, what a parent was, and B, aspire to her loving her son through thick and thin. It was quite inspirational for me. I got so much more than I gave, and I gave a lot.
Thank you, Leah.
Naomi, can you hear me?
Almost.
Okay. Wait.
We can see you.
I've never asked you to speak louder until this moment. I'll regret it for years, but please.
You'll never hear the end of it.
Yeah. That's fun. So I think the first question is about what do what do we get out of it? I won't answer the Zoom question. It's been answered sufficiently. So yes. But the first question is like, what does it bring? Can you say it again? I mean, I was listening to people's answers. I couldn't remember the question again.
How has hospital clowning impacted your ability to process your own grief? Or how do you clown for yourself? Do you clown for yourself?
Oh, I got you. Okay, I'm going to answer this by saying that I think we all have different ways of doing that. So obviously I can only answer that for myself, but for me, a lot of it just goes back to the teamwork. And so each pair kind of finds their rhythm and their thing that in the way that they will process the grief. And I feel like with some partners, I process it differently than I process it with other partners. And so that gives me a variety of ways to kind of think about and deal with some of the things that are difficult that come up for us. And also gives me, I don't want to say opportunity, but to kind of witness how different people process grief in the first place and learn to be really respectful of that. So for me personally, I think that when we have some down moments in the office, one of two things. One is, as you might have guessed, I take a nap during lunch. My brain just shut off. It's true. It's my clown nap. I lie down and I'm out for like 15, 20 minutes. And the other thing is just getting even more silly and ridiculous and distracting myself. So we make each other laugh about whatever. And then the third way, although I said there were two, might be to actually sit down and process and talk about what we saw. And sometimes, and just feel what that is. So I think there has to be a good balance, and for where you are in that moment in your life and in that day, and how you take that all in and how you process it. If you take all of it in, you're not gonna be able to do the work. But if you are not feeling any of it at all, for me anyways, that would feel like, oh, then I'm not really being present to the work. So it varies, the answer.
Yeah.
Thank you so much. Okay, so clowns, Facebook people, we've been sitting for 40 minutes looking at our screens. So even though we just talked about how great Zoom clowning was, I think it's time for everybody to just wiggle a little wherever you are. You probably need to stretch your face, roll around, take a break. Oh, okay. This is me getting stressed out and trying to look at my phone and computer. Woo! Okay, Calvin's showing off. Okay. And we're back. So our final question is, how do you think clowning in everyday life can help create human connection and build community? Do you use clowning in everyday life or only in specific settings? So I'm going to I'll try to answer this question and then pass it away. For me, I think I'm my best clown when I'm listening and noticing, and I've especially noticed on Zoom, there are these moments that I'm taking things very, very, very seriously, and then I kind of catch myself and realize like, oh, actually, that was kind of fun, or like, oh, it wasn't that bad. And so I think for me, clowning in everyday life is about being awake to possibility and connection, and to finding a game and to finding a connection maybe where I didn't expect to find one. Calvin, are you frozen or are you a statue? Okay, I'm gonna text Calvin. Adam, how about you answer?
Oh, sure. Oh my God. Oh, he's back. He's not back.
Hello?
Yep, you're back. Okay. Hello.
I'll keep on going. So to kind of answer the last question in this one, self-acceptance is the key to all of my problems. So if I have an expectation, like I hopefully am my authentic self, and if I have an expectation that I need to be funny, which is also the gift of hospital clowning, because if I have in my mind what result I need from my audience, I'm dead in the water. And if I accept, in a sense, where I am emotionally that day, as a very famous and accomplished clown would said, sometimes plumbers don't want to plumb, but they still plumb. It's the same thing with clowning. So, I have a job to do. So if I'm not in a good mood, I don't have to invoke or impose that I'm in a good mood. I can still do the work that I need to do. And then it's like kind of the car going through the skid. Once I kind of accept maybe I'm angry that day, that becomes part of my humor and my connection. So what was the question again?
Yeah, you answered it.
Okay, great.
Yeah. Does anyone else want to talk about clowning in everyday life, clowning in your own life? Wiggle your hands at me and I'll spotlight your video. Oh, Meredith. Yay.
Yeah, well, it's interesting because I often think about clowning. I mean, I'm wearing a nose, but I don't have to wear a nose to be a clown. I do skill stuff, musical juggling stuff, but I don't have to do that to be a clown. So I really, as I've gotten older, and after 20 years or so, it's like I think it's easy to get philosophical, but I really try to keep all of the possibilities of all of those skills that I might have, and to use those if it presents itself. But ultimately, I have to be enough just as me, just as the person that I am, as the clown that I am. One of my favorite rooms, which happened relatively early in my clown life, is I was with my partner, and for whatever reason, the two of us walked into the room, and there was some family there, and they just started laughing. And I kind of paused and didn't kind of know what to do, and they were laughing. And my partner reached into his pocket to pull out a prop, and I stopped him. And I kind of stopped my urge to do something. And literally, the less we did, the more they laughed. I resisted the urge to do something, and just kind of was in that moment, and just literally being the clown in the room was enough. And then I turned to my partner, I said, well, I think our work here is done. And we walked out the door, and they laughed even louder. And so sometimes I think it would have been very easy to go into that room and pulled out my juggling props, played a song, done a clowning bit, and it would have been fine. But the knowing and being open to just kind of being who I am, I don't have to have this to be the clown. I'm wearing it now. But that's really the essence of the work. And I think it's kind of hard to get there, because we literally and figuratively put on all of these things, but ultimately it's about the human connection, and it's about, to some degree, recognizing how absurd our existence is, or how happy our existence is, or how sad our existence is. And clowns, simply put, there's a lot of ways of looking at clowns, but clowns are basically whatever emotion you're feeling, just put on extreme. Sad, extreme; happy, extreme; boredom, extreme; moderate, extreme. So that's one way of kind of looking at it.
Thank you.
I can get philosophical, but I'll stop talking now.
Calvin, Leah, who wants it next?
I'll say something if that's okay, Leah.
It's all you, Calvin.
I love everything that you get. We've all been talking about here, and we certainly, I agree with you, Meredith. We can get really philosophical and talk about this for hours upon hours, but we're not going to, Naomi. Don't you worry. We're cutting it off. All you guys, we're cutting it off soon. No, it's in my own personal life. I know that it's allowed me to really feel safe in vulnerability. I think we have this in this experience that you just now talked about, Meredith, with being able to just be there and be present. And I think oftentimes, especially now, we feel like we need to do something. And think about even today's landscape where we're all sheltered. We're all feeling like, oh, we're supposed to be doing something. We're supposed to be working. We're supposed to be, you fill in the blank. And so what if we all took this philosophy of healthcare clowning, where what if we can just breathe into it and just be present? Why can't we live in that vulnerability, knowing that we can be safe, knowing that we can just listen and find out what it is that we need to be doing? Maybe perhaps we just need to be here in a Zoom room talking to a bunch of other clowns and talking to people who are interested in clowning. And so I feel like for me personally, healthcare clowning has really allowed me to have that perspective and really slow down and be able to be present in that vulnerability.
Thank you. Leah, the last word is yours if you want it.
I want it. Okay, so I feel like at the end of the day, as a clown, it's our job to connect with people, especially in hospital clowning. And then once we've formed that connection, which sometimes takes a little time and sometimes happens instantly, then we break through all these barriers through kind of changing the energy in the room and through humor and laughter. And that's, in my life, that's my main way of connecting with people. When I, in any form, in any part of my life, when I can kind of laugh with someone about topics like silly and big and deep and not whatever, I instantly feel connected. That's me. So that's sort of, I think, how the work continues in my life. But I think that in our connection in hospital clowning, we're always bringing ourselves into the room. And that means we're bringing all of our own history, all of our everything. And that affects our ability to connect with people. And some of that is totally unspoken, and well, most of it is kind of unspoken, and sometimes it comes to the surface and sometimes it doesn't. But I think what it pushes us to do as individuals is to continue to look for and find those connections where we otherwise might not. And so I think that's one of the beautiful things about clowning. But I think that we all have our kind of shticks or our things that we go to, which can be really useful and really wonderful and can be great. And I think, like I think everyone was saying, but like you bring who you are. And so all of the things that are sort of like what makes me and identifies me, I'm always bringing that into the room as well. And so it pushes me to grow in that way, which is fun and difficult and great.
Thank you so much. I want to thank everyone here. There's going to be a moment where we'll all show up on your screen again. And again, I'm Naomi. I'm the Executive Director of Clowns Without Borders. We are in this moment when our tours and live performances are canceled. Our work is not, so we're trying to find new ways to connect with you, go deeper, host some conversations we don't always have. Every Thursday we'll either be in Zoom doing a screening and conversation or having a Facebook Live event. If you have an idea for a panel or you think that you should be on a panel, please DM me, let me know. We also, I know a few of you in the comments have wondered about mindfulness and clowning, and on Tuesdays at 1:30 Eastern, which is 10:30 Pacific, we have 15-minute workshops. They're called Lighten Up with Moshe Cohen, the founder of Clowns Without Borders, whose whole work is in mindfulness and clowning. So here's the whole gang. Everyone, you can do whatever you want to say. This is the curtain call. Woo! Thank you so much.
Thank you, everybody.
Learn more about these incredible organizations. I've linked them in all of the comments and added the books.
Thank you, Naomi.
Thank you
Thank
so
you,
much.
Naomi,
Yes.
thanks everybody.